To give us an overview of our uh, tasks at hand, please welcome the Executive Director of Asia eHealth Information Network, Dr. Alvin Marcelo.
Good morning, everyone. Thank you. Thank you. Thank you to the Secretariat for preparing the slides. And I think I only have 10 minutes, so hang on to your seats. So we all know about AHIN, so I'll skip some slides. Our vision really way back in 2011 was just come together and help each other. To be honest, we all felt that we were having the same problems, and some solutions were in some countries and some solutions were in other countries. And if we just put our heads together, we might be able to come up with a more comprehensive solution. So as Dr. Bunchay said, AHIN is, the slogan of AHIN is, when we help friends, then those friends will help us. So that's, I think it's still true to today. A lot of members joining the group, from 7 members in 2011 to more than 1,300 last count. With a lot of them are experts contributing their time to the network from ministries, academe, NGOs, and other sectors. You've seen these people, they're in the audience right now. Please stand up to be acknowledged. Dr. Fazila, Dr. Bunchay, Jai, and Anis, they're the governing committee. They are accountable to the network. And then we have our AHIN Secretariat over there. So please stand up to be recognized. Charis, Christine, Piraya Lukwa, Jocelyn, Joseph, and Vian. So we have a working council in AHIN. These are representatives from each country, one preferably from government and the other from academe or non-government sector. So please stand up if you are an AHIN working council member. Dr. Chancellor Klube, Dr. Anil Tapa, thank you. Dr. Palita, you're actually a member of the working council. Dr. Engbold, thank you. Thank you. Dr. Shevmoni, soon you will become a member of the working council member. Of course, our partners have from Cambodia, Dr. Shevmoni. Our partners have already given their messages. Thank you. And we keep in touch with them. We invite them to our meetings, make sure that if they have resources and if they can contribute, they're always welcome. The communities within AHIN. So it started with just a few people having an itch on how do we solve this interoperability problem within public sector and between public sector and private sector. And one group that emerged are the architects. So with funding from WHO and NORAD, we were able to train 50 people from Ministries of Health on TOGAF, which is an enterprise architecture framework. And these people, upon graduation or getting certification, we formed them into the Regional Enterprise Architecture Council for Health. We formed this group because we realized enterprise architecture is hard. No one person can actually do it, but one person can oversee that the enterprise architecture process is moving forward. And that's what we envision the graduates of TOGA from AHIN will do. We think they need help. They'll need help from certified enterprise architecture firms, but they can supervise and oversee the work of these professional firms. They will be a shared resource. The next group is COIL, or the Community of Interoperability Labs. In our Colombo meeting, we agreed that this interoperability problem need to be grasped with both hands. So we asked for volunteer countries who would like to form interoperability labs. And 7 countries raised their hands. And since then, we've been helping each other share knowledge, insights, tools, and techniques. Of course, we have Thailand, Taiwan, Philippines, Vietnam, Indonesia, Sri Lanka, Mongolia. And if you are interested in forming your own, please approach us on Sidelines and we'll help you build one. One of the strongest right now is the Standards and Interoperability Lab Thailand. Dr. Rat and Nat Danai are in the audience right now. You can approach them. They're working on outpatient medication exchange information. Of course, Dr. Bunchay is their mentor. They have quite an extensive roster of specialists and experts in their group. This is a brief history. I'll skip it, Dr. Bunchay, in the interest of time. The third group are the AHIN researchers. So these are the academics who are members of AHIN. They publish papers, they collaborate on writing framework documents. Professor Teng Liao and Professor CP Wong are our heads for AHIN research. Dr. CP Wong is over here. If you have an idea for a paper, I think, or a manuscript, let's talk about that while we're here together. Then we have the Open EMIS Community of Practice. This is a group of academics and NGOs looking at the Open EMIS software and finding out what's the sweet space for open insurance management information systems in the country. We have Dr. Julius Migrino over here from San Beda, who is one of the members of the Community of Practice. Of course, in Nepal, the Tribhuvan University hosted our datathon. They looked at the Open EMIS data model, and they looked at the Thai DRG data model, and then we asked the students to do the mapping between the Thai DRG model and the Nepal Open EMIS system. Of course, in anticipation that later on Open EMIS will be DRG ready. And of course, in recognition of the work of the Thai team on the DRGs. In Indonesia, Dr. Anis Fuad is in the audience. They implemented Open EMIS and embedded it in their Masters of Public Health program. In the Philippines, together with Dr. Julius Migrino, we went around the medical colleges and promoted to the medical colleges, look, you don't have an EMR, but everyone wants to use an EMR. So you can use Open EMIS. And in Open EMIS, you not just show them a simple EMR, but you can also show what the insurance agency actually looks and how to develop benefits for your patients. So we have 4 medical schools participating there. We just launched our Standards and Interoperability Lab in UP Manila, and it's called CILAB, which is actually a Filipino term for a blaze, which is similar to fire. So CILAB is the group that we formed. Dr. Miguel Aljibe was here yesterday, but he will be here later today. In Sri Lanka, there's the Health Informatics Society of Sri Lanka, and they're also setting up their own interoperability lab. We have set up an Open EMIS e-learning capability. So AHIN has a Moodle-based e-learning platform. And if you go to this academy, you will see a lot of materials on Open EMIS. We will share the link later on with the community. This Open EMIS e-learning platform is being launched as we speak, and we are open to suggestions from the audience on how you would want to use this in your own country. Right now in the Philippines, we're using it for medical schools to introduce concepts of health financing and health informatics to medical students. Of course, thank you to our Thai friends and colleagues. We had 5 modules on DRG, or diagnosis-related groups. This is an emerging technology. If a country wants to use health financing correctly in combination with health informatics, then DRG is the way to go. And Dr. Bunchay and Dr. Supasit were kind enough to give us 5 modules. You can play this back. It's on the Open EMIS e-learning platform. And then Dr. Julius helped us create how to use Open EMIS as a tool for COVID-19 response. It's a practical guide. Thank you, Dr. Julius, for this content. Again, this is on the e-learning platform. And then the Nepal delegates, the Professor Rabindra from Kathmandu University created a training program on how to install Open EMIS on a Linux server. We have a lot more materials on Open EMIS, and you can see that in our website. AHIN Academy is now in that Moodle e-learning platform. If you have content that you want to share to the other countries, please let us know. I'm particularly interested in how Malaysia actually built your health data warehouse. So if you can find time to teach us how you did it, please, that will be most welcome. We also offered a certificate reimbursement program. What is this all about? So we encourage our members to take a course and to get certified. But before they get certified, they have to pay for their own certification first. But if they succeed, we do give them a reimbursement. So basically, it turns out to be free. but you have to pass first. It's an incentive. It's a strategy of AHIN to make you work and pass your certification. And congratulations for those who were able to get certified. We worked with MIT Critical Data. A cohort took the MIT AHIN mentorship program. I was one of them who passed the course. It was quite hard. We had the Health Data Governance Regional Workshop with support from Transform Health. This was a series of discussions and consultations that culminated in our session yesterday. Thank you for participating. We sponsored about 40 members of AHIN for the OpenHIE certification. They took the course and 30 already got the certificate. So we reimbursed them for passing the certification course. And a cohort of 40 were made scholars in the AHIN Fire Proficiency Training Program. As we speak, they are now reviewing for their certification exam. I wish them luck. And this is now currently ongoing. There are 100 AHIN members currently undertaking the blended type of training of the Digital Health Planning National Systems. We're on our third week. We will have our meeting tomorrow night. It's a very interesting topic. And I told Merrick last night that we should find a way to get more people trained on digital health planning national systems and maybe digital health planning local systems, because national is important, but later on the local will also start asking what's in it for us as well. Convergence workshops basically is a workshop where AHIN supports the ministries of health to gather support from the other ministries and the other sectors like private sector. So here the Ministry of Health is the organizer, and AHIN, we help by bringing in resources, government officials from other countries, development partners to hype up, the need for the Ministry of Health for support from the other sectors like the Ministry of ICT, health finance, and from the economic development. So how does AHIN help the Ministry of Health? Well, if you express, just send us an email and we'll help you through the process. In the end, we've found this to be a very effective workshop. It is where the other ministries actually come together, and the first time they hear about the plans for digital health or the MOH, and they all raise their hand and say, "We're here to support you. Just tell us what you need." So they I think it's just bringing people together and understanding that the Ministry of Health has some needs and that they're willing to support. So a lot of these have happened already. The first one was in Myanmar, and then Bhutan, and then Hanoi, and then in Nepal. Raj, I think you were there. And then the second one for Bhutan. And then our most recent one is in Lao PDR with Dr. Chancelley and Dr. Tep. Of course, the general meetings, I'll just skip through them. Bangkok in 2012, Manila 2013, Manila 2014, Bali in 2015, Naypyidaw in 2017, Colombo in 2018. We didn't have one for 2019, and we had the virtual one in 2021. And today, we are offering hybrid. And I'm happy to see the faces that we wanted to meet in Manila. AHIN Hours are our webinars. So many of them, actually. So the most popular, by the way, is Malaysia on Fire. So I appreciate the team of Dr. Fazila telling us their story about how they're implementing fire in a particular province and what are the challenges and what are the tips and techniques if you want to do this on a pilot basis. Okay, health data governance principles, driving access and equity in virtual health through inclusive policies with Transform Health, the DRG webinar series, open source webinars, technical documentation with support from Digital Square and Path resource persons and WHO on Fire and how to use the Fire app SDK. I'm getting tired just listing through them. So in summary, just remember this. Mind your gaps, your governance, your architecture, your people, and program management, and your standards. Because with them, then we can start flying with our digital health development. Good morning, everyone.